We good?
Yep.
Good afternoon, and welcome to the April 9th, 2020 meeting of the Needham Select Board. My name is John Bulian. I'm the Select Board Chair, and permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Mo.
Here.
Matt.
Here.
Dan.
Here.
Marianne.
Here.
Thank you. Staff, when I call your name, please respond in the affirmative. Kate. Dave.
Here.
Tim.
Here.
Kate.
Yes.
Thank you. Okay. Good afternoon. This open meeting of the Needham Select Board is being conducted remotely, consistent with Governor Baker's executive order of March 12, 2020, due to the current state of emergency in the Commonwealth due to the outbreak of the COVID-19 virus. In order to mitigate the transmission of the COVID-19 virus, we have been advised and directed by the Commonwealth to suspend public gatherings. As such, the governor's order suspends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed and encouraged to participate remotely, which we are. The order allows public bodies to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will not feature public comment. For this meeting, the Needham Select Board is convening by Zoom app as posted on the town's website identifying how the public may join. For Zoom meetings, please note that this meeting is being recorded and that some attendees are participating by video conference. Actually, all attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you, and take care not to screen share your computer. Anything that you broadcast may be captured by the recording. Meeting materials. All supporting materials that have been provided members of this body are available on the town's website unless otherwise noted. The public is encouraged to follow along using the posted agenda unless the chair notes otherwise. Ground rules for this business meeting. We are now turning to the first item on the agenda. Before we do so, permit me to cover some ground rules for effective and clear conduct of our business and to ensure accurate meeting minutes. I will introduce each speaker on the agenda. After they conclude their remarks, the chair will go down the line of members, inviting each by name to provide any comment, questions, or motions. Please hold until your name is called. Further, please remember to mute your phone or computer when you are not speaking. Finally, each vote taken at this meeting will be conducted by a roll call vote. With that, I would go to item number 1 on the agenda, which is the COVID-19 update, Emergency Operations Center and Health and Human Services, and I would recognize Tim McDonald, Director of Health and Human Services. Tim?
Thank you very much, Mr. Chair and members of the Select Board. Here to provide a brief update for you. As the Select Board knows, late on Friday, late afternoon, early evening Friday, the Federal Centers for Disease Control and Prevention revised the guidance that it provides to all Americans and recommended that Americans wear a cloth face covering or face mask in public settings. It's still emphasizing its guidance on social distancing. It's still focusing on having medical grade masks, which are surgical masks or N95 masks reserved for healthcare workers and first responders, but it's asking members of the general public to put on a cloth mask. A cloth mask, it's important to understand, is not a replacement for social distancing. And the best way to understand it is that it is primarily designed to protect other people from you. By having it on, you're not transmitting droplets as effectively into the environment. But this is a request that the Centers for Disease Control and Prevention have made to all Americans, and it's something that we're working in the town of Needham to implement with our staff that are still working physically in person. There's a number of very generous residents in Needham who've donated cloth masks, and we have a number of them, and they've been distributed to frontline town workers. Obviously, as I said, the medical grade masks are kept for our first responders, but there are a number of people in roles in building maintenance and the Department of Public Works. There are, for example, school personnel who are handing out lunches twice a week to a number of families in need. And There are public health division staff, there are inspectors who go into buildings, including restaurants, to make sure that there are safe and sanitary operations. And so through the generosity of a number of people in Needham, all of those groups have cloth masks and cloth face coverings. And starting today, we were actually able to make donations to the grocery stores. We contacted the Emergency Operations Center, contacted each of the grocery stores in Needham and asked them if they needed help because residents had been so generous. 2 of the 3 said they do need help right now. The 3rd said not at this moment. And our fire chief, Dennis Condon, delivered those this afternoon, just after lunchtime, to 2 of the grocery stores in town. I think Americans need to understand potentially, and the town has developed an infographic that it's going to send out via Twitter and in the daily update about how to use a mask safely and appropriately and what guidance we would give. And so some of the most obvious things are to not play with your mask and to not touch your hands to your face. Masks generally help us because it is so different from what we usually have. It serves as a good reminder for us not to have our hands touch our face. But we're going to be distributing that infographic later this afternoon through social media and through the daily update, which I hope many residents have already signed up for on the town's website. That newsflash is very helpful. I did want to mention to the select board that a number of residents have seen, and hopefully they've seen our social media posts, that the National Guard has been and will continue to be in the town of Needham, making deliveries of personal protective equipment to first responders, which is coordinated out of the fire station, as well as doing testing at long-term care facilities. The National Guard is testing residents of long-term care facilities who have shown symptoms if requested by that long-term care facility. So that is help that we are getting from the state government, and it's help that we are very grateful for. The Public Health Division is coordinating frequently with our long-term care facilities and with the Beth Israel Deaconess Needham. The coordination is happening on both an operations level. So our public health nurses are speaking to the infection control nurse in their facility or the charge nurse in long-term care facilities, as well as on sort of a strategic level. I think the town manager has mentioned previously that she has a call weekly with the president of the hospital. That's a very valuable source for us, and it helps us make sure that we are providing resources to support these very important community assets. The other item I wanted to highlight just briefly for the select board is that I mentioned that a number of residents have been incredibly generous by making cloth masks for employees that are at the front lines and for grocery store workers. We've also had a number of people volunteer to help. The senior center has taken in volunteers that are interested in helping Needham seniors, and there's a link to sign up on our website, and also in the daily update, we're going to highlight it again today. The town has also accepted a number of new volunteers for its Medical Reserve Corps. And the Medical Reserve Corps, despite its name, is open to both clinical personnel and non-clinical personnel. There's still interest and need if we were setting up, for example, a community vaccination clinic, which is our hope when there is a vaccine for COVID-19. We will need help with people sort of checking in. We'll need help with people filling out forms, helping residents fill out forms. So to volunteer for the Medical Reserve Corps, you don't have to be a nurse or a doctor or a respiratory therapist. That's something we're again going to highlight, and Needham residents have been very generous in signing up, and we really appreciate that.
Good. Thank you, Tim. Kate, let me turn it over to you, and if you could also tell us about current state of operations in the town as well as part of.
So a couple of things that I wanted to highlight, just to augment what Tim had said. We wanted to talk a little bit about the generosity that we're seeing from the community. Over the last couple of weeks, residents, organizations, and individuals have really stepped up donating time and goods. We put out a donation bin at the Rosemary Recreation Complex this week, and we've already collected more than 260 masks that way. Wow. The Chinese Friends of Needham, a local organization, has donated 1,000 surgical masks to us, to the community, and they're actually planning on donating more. Both the schools and the Exchange Club have also donated supplies, including gloves and masks. We, as Tim mentioned, we've been able to distribute these supplies to first responders, but also to healthcare providers, and as he said, now the grocery store employees. So that's been great. While we continue to accept donations at Rosemary, the hospital is also accepting donations, and they've moved their donation bin over near the emergency department. And yesterday, MEMA delivered to us a significant amount of personal protective equipment. We got, through the National Guard, as Tim had mentioned, 400 masks, 295 masks, which are the new gold standard, where people are really trying hard to get, 150 gowns and 200 caps. So that was our second delivery of PPE from EMA, and we're really grateful. And just today, a local resident planted pansies in the pots in front of Town Hall to brighten it up. So that was a really nice, generous donation. I wanted to talk a little bit about the RTS. Last week, we told you about our plan to enforce social distancing and minimize contact at the RTS. It's been an amazing success. The residents, we've received many compliments from residents who feel that it's a safer location for them to dispose of their waste. People were very patient with us. They are shifting some of their behavior, and the employees were really grateful for that support from the town and from the board. Another thing we're looking very much at this week is thinking about the business community and providing additional thought to that. The business community is really being impacted by the pandemic, but they're also stepping up in terms of donations and really working in creative ways to stay in business and to help out local organizations, particularly our first responders and our hospital. We're working on a number of fronts to try to find a way to recognize their efforts and to help them out. I know that whenever we can, we're buying takeout like everybody else, but we'll have more to report in the coming weeks about how we might be able to help the business community. A few entities that have really helped out this week include Wegmans and Cafe Fresh for helping us out with working with our seniors and providing meals for them. And yesterday, as Mr. Chair knows, because he was a panelist, Tim and Cindy Gonzalez and I and the chair did a webinar with the Newton Needham Chamber of Commerce, and we answered questions from, they had a nice crowd of business owners and workers who were on the call, and there was also a representative of the Office of Business Development from the Commonwealth providing really actually very helpful links for people who called in. So really this week, Mr. Chair, there's not much different from last week. Just again to thank police and fire, public works, our custodians, health, emergency management, and we have a spare amount of administrative and professional staff coming in for limited hours so they can swap out work and go back home and do their work at home. And as any of you who are trying to work at home know, it's not really work at home. It's, be home, worry about a crisis, and then try to work in your work around what can be family and pets and difficult internet access. So we're just all trying to be patient and work together. So that's my report, Mr. Chair, and I'd be happy to answer any questions.
Thank you. Let me go to the members for questions and comments. Dan?
No, I don't have any questions at this time. Thank you. It's a good report, and I appreciate all the work that everybody's putting in and the support from the community.
Thank you. Matt?
Thanks, Mr. Chair. Thanks for the report. I am interested about the business community, as you said, Kate, seeing what ideas we can come up with to help them out. I did have a question. I've gotten asked about Rosemary and the opening of that pool as we think about spring and summer. Do we have certain dates that we're targeting to make decisions? I know it's such a fluid situation, it's early, and I guess the consideration of maybe, a shortened season. When do we feel we're going to start making some of those decisions? More like May timeframe, or do we not know yet?
So we have a plan to open the pool on time. And then we have contingency plans to what would be the cost benefit of opening it, depending on whether social distancing is allowed. In the current environment, the governor's order is no more than 10 congregating through May 4th. A reasonable person might think having hundreds and hundreds and hundreds congregating just 4 or 6 weeks later might be unreasonable. So to put out there that it's likely to be impacted this summer for sure. But again, we're putting together the regular plan and then 2 or 3 contingency plans, and we'll work with the Park and Recreation Commission over the next probably 4 weeks is when we'll know what's happening. And when we hear more from the governor, it'll help inform those plans even more. But it is a disappointment in the long list of other disappointments related that are not quite as serious, but are still a disappointment for many.
Thank you.
Bo? Unmute. Mo.
How's our morale with respect to our first line responders and town employees? I know they're working under very adverse conditions, and I just want to make sure that they know that they have our support, but also how are they doing?
Well, all reports are that I think like every person in the world, there's a great worry about our own safety, the safety of our families, and also the worry about how long this could go on. Our public safety employees are working their regular shifts, so they're really never, it's not like there's a lot of downtime. Nobody's going on vacation. So it's just a constant, every day doing doing that work. I think, I don't want to speak for the chiefs, and we could maybe have them come to another meeting if you'd like that for an update, but I do understand that when there's a comfortable and adequate supply of PPE in the town, then people feel much more comfortable about their situation, and we're just grateful that we have that now.
Thank you.
Marianne?
Hi, a couple of questions. One, I'm wondering, in sharing the masks with the grocery stores, are there also some that we're able to share with the pharmacies in town? Or are they covered, like CVS, Walgreens, another place that people are traveling to?
Sure. So because pharmacies qualify as medical facilities, they're able to actually get surgical masks. So they have access to both a different supply and also additional different materials we could give them rather than sort of cloth masks for grocery store workers who are, of course, in a very important role at this time. So they have access to surgical masks, which are a higher level of protection.
Thank you. And maybe I would know that if I'd been to one, but I haven't. So the other question I'm wondering is, with the additional PPE that we've received, are we in a position where we're able to have access to decontaminating our N95 masks? Is that something that we'll be able to do so we won't need a continuing supply?
So at this time, the governor has highlighted it in his press conferences. The facility that Partners opened in conjunction with the city of Somerville and Battelle is right now focused on decontamination of healthcare workers. There's some question once they get up to full steam whether there will be capacity to take on first responders, or whether it's going to focus on sort of an ever-increasing, ever-widening circle of hospitals that will be able to sort of reuse their PPE with them. So it's a little unclear, but right now our focus is on getting additional PPE. The fire chief and the police chief have already worked with public health and with their own state-based associations to come up with ways to safely extend the use of personal protective equipment, including N95 masks and surgical masks. And they've been very creative working within the guidelines of what is safe and what is appropriate and healthy.
Okay, great. Thank you. I appreciate it.
And Tim, I'll just say that, I think there's no question that obviously first responders and hospital personnel, medical personnel have to have PPE. I think that it's great to hear that that the markets are reaching out, because everybody has to go to the market, and we all need food. And what we don't want to do is we don't want to fear that that supermarket employees are getting sick or are in a position where they could pass it to somebody, to people that are coming in to shop. I think there have been a couple of recent reports where there have been some grocery store employees that have taken ill. And it just, people, I think hopefully things are starting to settle down as far as at least the ability to get toilet paper. It seems to be available, but I think people need to feel as though that, we're on a every 2-week run on the supermarket. We don't want to go unless we have to. We have a list. We only go to markets that we know. And I think that, and that seems to be the general way people are conducting themselves. It seems as though this is we're moving towards peak in this area. How are our hospitals? What's the report? I did see the governor's news conference today. How are the hospitals faring as far as the number of cases and the ability to handle them, as far as you know?
So as I mentioned, the town manager talks at a strategic level with the president of the hospital. Our public health nurses also talk multiple times a day with the infection control officer for BID Needham. BID Needham as a community hospital is not in the same, quite the same predicament as an academic medical center, which would have much larger portion of ICU beds. But there are, you know, very seriously ill patients that are in the hospital, and they're doing their best to care for them. Our hospital has been very proactive in thinking about plans to sort of extend beyond the hospital of how they can do screening, how they can support healthcare workers in general. And I think that there's going to be some more announcements about that in the next few days. But BID Needham has been very proactive, and we really appreciate sort of how good a partner they are with the town. To the point that the chair made just a moment ago, our grocery store operators, I think people might have known that the governor gave a or the Commissioner of Public Health for the state gave a revised order affecting how grocery stores operate late on Tuesday afternoon, early evening. Yesterday, we had questions pending when we arrived in the office from our grocery store operators who are very responsible and obviously care a great deal about the safety of their staff and their patrons, saying this is how we're going to reconfigure, this is how we're going to modify or change things slightly based on the guidance that the state just gave. So I think residents can hopefully have some assurance that there is 3 very good operators in town who take very seriously the safety of themselves and their customers.
I know that Trader Joe's allows only 25 customers in the store at a time, and people queue up outside of the store. What are the numbers that your understanding is for Roach Brothers and Sudbury Farms as far as the number of people that they would allow in at one time?
So the governor's order restricts grocery stores to 40% of their maximum permissible occupancy. Our grocery stores in Needham, because of the way they've set things up and the way they've sort of designed their sort of flow of operations, including sort of a elongated checkout process and a process to get into the stores, have been operating well below that 40%. And I think that's a decision that they've made for the safety and health of their customers and for their staff. If you look at the square footage of a Sudbury Farms that's approaching 20,000 square feet, including the back of the house areas, which is counted into the maximum permissible occupancy. I, by the way, don't know that off the top of my head. I had a discussion with the building commissioner this morning. That's the only reason I can say that. Their occupancy, 40%, would be much higher. They've been operating less than that for the reasons that they want to keep people safe and healthy.
How many people, do you have any idea how many people that might represent? Are we talking about 100 people at a time in a Sudbury Farms? 200 people that might represent 40% or less? Or Dan, you're nodding, you think more? Unmute. Dan, unmute. Dan, unmute. I can't hear you.
Can I say something?
Yeah, Marianne, you can say
So I'm going to say, from
Hold on,
what
Dan.
I'm hearing
Yeah.
from my husband, since I haven't been out,
Yep.
he believes that they are operating, as Tim said, way below that 40% threshold. And I would not expect to see them increase to the 40% threshold. I think they're doing what they think is right for their employees and their customers. So,
Okay. Dan?
I'm just that from observation at Sudbury Farms, I would concur with what Tim is saying, and I haven't counted the people, but there's people are very good about the spacing, and I haven't seen anywhere near 100 people in the store during the number of times that I've been in.
Yeah, if we're strictly going by the numbers, Sudbury would be well over 100 people would be allowed based on 40% of their maximum occupancy. And they are well below that.
Okay.
In fact, I would say I've been to, I guess, all 3 stores at different times during the last few weeks, and I'm really I think I'm echoing what Tim is saying in terms of being really impressed at how carefully and creatively they've organized things with an eye both to the safety and as well as trying to make it still a good place for people to go and shop and get their business done in a good way. It shows a lot of thought and care. Thank you.
Good. No, thank you. Comments by members? No. Okay. Thank you, Tim, for that report, and Kate. I do need a motion for the consent agenda.
So moved.
I'd like to move the consent agenda.
Second.
We have a
no-
motion, we
Yeah.
we have a motion and a second on the consent. Dan,
Yes.
Matt,
Yes.
Mo,
Yes.
Marianne?
Yes.
The chair is yes, unanimous vote. I do want to, before I ask we go to adjourn, unless there's anything else that Kate has or anybody else has, I would like to acknowledge the passing of Admiral James Steele Gracie. And let me read what was sent that the board received from the Coast Guard Commandant. It is with great sadness that I announce the death of Admiral James Steele Gracie, United States Coast Guard retired, 17th Commandant of the Coast Guard, who passed away on Sunday, April 5th, 2020, in Falls Church at the age of 92. Born in Newton, Massachusetts in 1927, Admiral Gracie grew up in Needham and was part of the Needham class of 1945, graduating class. Admiral Gracie graduated from the United States Coast Guard Academy in 1949. Admiral Gracie was a 1956 graduate of Harvard Graduate School, where he earned a master's degree in business administration. He was promoted to flag rank in October of 1974. His flag assignments included Commander, 9th Coast Guard District, Chief of Staff, U.S. Coast Guard, Commander, Coast Guard Pacific Area, 12th Coast Guard District, and Commander, Atlantic Area, 3rd Coast Guard District. In 1990, Admiral Gracie received the Needham High School Distinguished Career Award. And in 2000, Admiral Gracie Drive was dedicated in his honor on the occasion of his 55th Needham High School graduation. Admiral Gracie is survived by his wife of almost 71 years, Randy, their daughter Cheryl, and son Kevin, 3 grandchildren and 2 great-grandchildren. He was preceded in death by his daughter Pamela. For all of us who raised children in this town and drove up Admiral Gracie Drive over the many years and for the many other events that we took place at the high school, I felt it was important that he be honored here before this board at this time. And I believe that the plan of the board, I hope, is the board okay, and for discussion, to call for flags at half-staff for 3 days at a time that the town manager is able to accomplish that?
Yes.
I think that's an excellent idea.
So move.
Absolutely. Second.
Thank you. We have a motion and a second to allow that and to recognize Admiral Gracie for his contributions to not only having been raised in Needham and grew up in Needham and graduated from Needham High School, but also what he has done for our country. Dan?
Yes.
Matt?
Yes.
Mo?
Yes.
Marianne?
Yes.
And the chair is yes, and that is a unanimous vote. I'd like to wish everybody that's watching a happy Passover. Tonight is the second night of Passover, and I'd like to extend the warmest regards from the board, not only for those of us celebrating Passover, but also Easter Sunday that's coming up this Sunday. I know it's going to be different. There were many Zoom Seders last night. I'm sure there will be many Zoom Easter dinners on Sunday. It's a different time. It's a really extraordinary time that we're living in and living through. And let's all stay safe. I would entertain a motion to adjourn.
So move.
Second.
Second.
We have a motion and a second to adjourn. Further discussion by the board? Hearing none, we come to the vote. Dan?
Yes.
Matt?
Yes.
Mo?
Yes.
Marianne?
Yes.
The chair is yes. Thank you so much for tuning in today. Thank you. We are adjourned.
Okay.
Good night.
Just a reminder, the next meeting of the board is Tuesday, the 14th.
Thank you.
Thank you. Thank you, Kate.
Thank you, Kate.
Okay.